Hi, I'm Robin Boyce, the City Corner. Today we're going to talk more about the restrictions that have been lifted here in the St. Louis area after this long pandemic. Also, we're going to talk more about redevelopment on the Kingsway. Come on back. Back in the studios, we're going to be talking with Dr. Frederick Echols, who is the acting director of the health department for the city of St. Louis. Dr. Echols, prior to becoming on board, was in the position of working as the chief of the communicable diseases for the Illinois Department of Public Health. And he's a physician in the U.S. Army or the U.S. Navy, where he managed several medical people at that time. He's also doing some really good things out the St. Louis area and making sure that we stay healthy throughout the area. Today, he's here to talk with us about the lifting of the restrictions or masks and some of the other things that we have going on due to the COVID pandemic that we have. Dr. Echols, are we looking really a lot better here in the city of St. Louis, or could we do better?
We're looking much better than we were several months ago. If you recall, back in the fall of 2020, the city of St. Louis and the St. Louis region, along with other parts of the nation, was experiencing a surge of COVID-19 cases. And the surge was so severe that we were essentially overwhelming our hospital systems as well as our public health systems, which made it extremely challenging to get a grapple on, good grasp on transmission in this St. Louis area. So right now, what we've seen over the past several months is things somewhat stabilizing. So the number of cases related to COVID-19 have actually gone down to now in the city of St. Louis. We're averaging roughly single digits as it relates to COVID-19 cases being detected. And our percent positivity is also going down. So back in the fall of 2020, we were above 10% for our percent positivity rate. But now we're hovering around between 4 and 3, which is much better than we were before. And so because of the mitigation measures that were in place and increased compliance, not only from individuals across our communities, but also businesses across city of St. Louis communities, we were at a point where we were able to loosen things up a little bit, because we also had to be mindful of the economic impact that COVID-19 had on in the city of St. Louis. And so as we got to this place where we were able to kind of loosen things up, we had to remind individuals that we were still in the middle of a pandemic, but we did have a new tool that was being distributed across not only in our jurisdiction, but across the nation. And that tool is the COVID-19 vaccines. The vaccines have, although they've been the center of a lot of controversy, what the data has shown us is that they are effective in preventing severe complications of COVID-19, including hospitalizations and death. Early on during the COVID-19 pandemic, we noticed that minority populations, particularly African Americans, were disproportionately affected by this virus. But it shouldn't have been surprising to us, because when we look at the pre-COVID conditions of our most vulnerable populations, these were the same populations that had the highest rates of diabetes, heart disease, chronic lung disease, including asthma and COPD, and other conditions of interest. And so our communities were essentially set back. And so when COVID hit, this was just adding one additional disease that was going to impact them.
That particular community anyway.
Absolutely. And that's what we saw.
Right, and then because it affected that specific community and still is, and like you said, pre-COVID, there were problems there anyway across the board with reference to other kinds of diseases that the human body can take on. Are we going to see some changes now in public health with reference to attacking all of these diseases across board? Because COVID really opened up a can of worms across the board for a lot of organizations, a lot of people, and just changing a way of thinking about working with people and doing things differently in the community now. Has this experience changed the way in which your department and other organizations that you are involved with across the St. Louis area health-wise, have you all started retinkering and retuning the approach?
Absolutely. So specifically in the city of St. Louis, particularly for this health department, at the start of my tenure, one of the things that I wanted to make sure every staff, especially staff among the executive leadership team, understood was the history of the evolution of certain medical service delivery or healthcare service delivery for indigent populations. And so when we understand the history, we can better position ourselves to properly ensure that we properly contextualize what's happening in this current time. Because everything is, as some of my mentors will say, nothing is new under the sun. So
Right.
the disparities that we're seeing, they aren't new. We've actually been reporting on them for centuries and even decades. And so it's important for us to understand how we got to this point. And so at that point, we really start trying to do a better job of understanding how the systems work together to disadvantage certain populations. And so oftentimes we'll call it X or we'll call it Y, but we have to call it what it is, which is racism. So systemic racism is really what has resulted in us seeing these disparate health outcomes, particularly for minority communities. And so what we're doing is making sure that we create.
It happens, and it's okay.
One of the things that we're doing is making sure that we create opportunities for our residents to have access to quality medical health services and support services through several of the programs that we implement, through our communicable disease program, through our women, children, and adolescent health program, our men's health program. We're all operating with health equity and health justice lens. So making sure that we're meeting the community where they are, but also understanding their plight and making sure that we don't just treat them based on their condition or engage them based on their condition,
Right.
but engage them as individuals first. When we understand them as individuals, we can better connect them to the appropriate services. And so when we do that, and we do that effectively and efficiently and consistently, then we'll be able to really change the trajectory of health for our residents. And that's part of our mission, which is to create an environment that supports everyone achieving optimal health.
Do we need more? I mean, the city of St. Louis at this point, we don't have a hospital situation anymore. We used to, but we no longer are in the hospital business. But on a clinical level, can we possibly see, or will we see futuristically, a little bit more satellite situations set up throughout the community that will be available for people for just regular shots for their children, or the flu shot, or the drugstores taking that place at this point? And is the city of St. Louis working towards some collaborations there as well?
Yeah, so again, going back to the evolution of the health system in the city of St. Louis. So when the urgent care, Connect Care was taken away, then that really the burden of providing quality services for our most vulnerable populations fell on the health department, but also it fell on the federally qualified health centers in the city of St. Louis.
Yes.
And as you understand what happened with the health department, so a lot of the clinical programs were stripped away from the health department over years, to the point where at the start of my tenure, we only had 84 staff in place. And so having 84 staff conduct all public health activities for the entire jurisdiction is really unrealistic. And so the health department itself was handicapped. That was the case for several years. And so when we look at the health outcomes in our community, we shouldn't really be surprised because we weren't properly supporting public health. But what we have to do now is really rely on those agencies who are well equipped to provide those services. And so we've been working closely with the federally qualified health centers, which include Affinia Healthcare, Betty Kerr People's Health Centers, Family Care Health Centers, and Care STL Health Centers, to make sure that we have additional access points for our residents. For immunizations and vaccinations, we also work with those entities as well to make sure that individuals who are underinsured and uninsured can access those critical public health tools to, again, move towards achieving optimal health. But we're also working to make sure that the community has a better understanding of how to navigate the healthcare system. Even for people who have medical insurance, sometimes you can get tossed from one agency or one individual to the next. but it's really important for us to empower the individuals in our community so they can more efficiently and effectively navigate the healthcare system to receive or get connected to the services that they need. And one important thing that we'll be working on at the health department is a program that highlights the importance of the class standards. So the provision of culturally, linguistic, and appropriate services is a standard that has to be met by all healthcare agencies, so the hospital system as well as the federally qualified health centers. But most individuals don't know about that, particularly those who are most vulnerable, and then that puts them in a position where they're not able to properly advocate for themselves. And so by giving them information on what we call the class standards, we'll help them better understand, what the medical provider's responsibilities are as it relates to providing culturally appropriate and linguistically appropriate services. And if they feel like they aren't receiving if they feel like they don't receive appropriate care, they have incidents where they don't receive appropriate care, there's grievance processes where they can report that information to the entity. And in some cases, if the entity is not responsive, they can report that directly to the federal government to hold them accountable. Because we have to make sure that we can properly advocate for our own health. So that's one of the goals of the health department moving forward, again, to make sure that our most vulnerable community members have an opportunity to not only achieve the services they need, but to really live a good quality of life.
To get more people in the city of St. Louis vaccinated, will you and your team be really pumping up some really good educational type programs and pushing the word out there to really get folks to really understand this vaccination helps, it works? Because there's so many people that I run into that say, no, I don't want to take it. They remember what has happened in the past. And wow, I really wish I could talk more with you about it. But with reference to education, I've got 30 seconds left. You're going to be moving on that?
Absolutely. So we partner with the St. Louis Science Center, who is a pillar of scientific information. And actually, they do an amazing job of delivering scientific information in a way that the community can understand it. So next week, we will actually be launching our education campaign as it relates to vaccines. In addition to that, we're working really closely with the mayor's office, and she's championing this public health initiative as well to get as many people vaccinated as possible. So we have several events over the upcoming weeks where we'll be going out, working with the mayor's office, the Boys and Girls Clubs in North St. Louis, as well as the St. Louis Cardinals, to get as many people vaccinated as possible. And so we really want individuals to have accurate information, because there's still a lot of misinformation circulating in our community, particularly minority communities. And so we have to work to be intentional about dispelling those myths, but also doing it in a way that's culturally sensitive and culturally appropriate so that people can receive it.
Well, Dr. Echols, let us know how we can help you out. We're here to make sure we get the word out for the City of St. Louis Health Department. Thank you for taking time out on your busy schedule to come in the City Corner and talk with us more about the restrictions being lifted and how important it is for people to get out there and stay healthy here in the St. Louis area. Thank you so much.
Thank you. My pleasure. Thanks for having me.
Thank you. I want to thank you, everybody, for tuning in to this particular segment. We've got some new information coming up next on redevelopment of Kingsway. Come on back to find out more.
Operation Wonder Park is a go!
There's nothing more powerful than imagination. But don't just imagine. Use STEM to change the world.
Who's with me?
Oh, it's gonna hurt tomorrow.
If she can STEM, so can you. Find out more at She Can STEM.
There's so many reasons to love St. Louis, you can't pick just one.
What I love about St. Louis is the 79 unique neighborhoods and 108 beautiful city parks, including Forest Park, which is actually larger than Central Park in New York, and the gorgeous Tower Grove Park right here.
And there's always something new to experience, no matter the time of day or the season. So come and experience St. Louis.
Hi, I'm Robin Boyce, and we're back here with City Corner, and with me right now on this Zoom call, I have a wonderful person that I met many, many years ago who has just grown up, blown up, and is doing his thing, and I love it. This young man used to walk into our studios over the Magic 108 studios with a sketch pad and his pencil saying he wants to be an artist. And guess what? He did it. And guess what's more? He is now the executive founder and developer of the Kingsway Redevelopment LLC. Meet Mr. Kevin Bryant. For those of you who don't know him, this is a great young man who has just really about to take on a section of the St. Louis area and redevelop it where people can live, play, work, and just really feel like human beings. I think it's just awesome. You're doing this just right past the Del Mar Divide, Kevin. Tell us more about this project.
Oh yeah, Robin, it's real exciting. Basically, my boundaries go from Del Mar, Kings Highway, Page to Taylor. That's the box.
Okay, that's the okay.
There's 207 acres of a community that when I reached out to see if I could be a part of ushering development over here, I couldn't believe no one had already done it. You know, honestly, this community was built the same time as the Central West End. It has the same housing stock. You know, there was some disinvestment because of some color folks, you know, that happened about 30 years ago.
Yes.
And it never really gained enough traction with any other development. But I didn't know any of that when I put my office here 18 years ago. I was just looking for some affordable rent. But what I watched was the Central West End just blossom, and that was always one of my favorite parts of town.
Yes.
While just 100 feet over, I watched the neighborhood implode, you know, with everything from crime, property values dropping. And I just wanted to know if I could do something about it because I was about to move. And too often in our communities, the brightest and the most talented of us, we just leave for greener pastures, you know. So I said, well, you know, I'm going to see if I can get the city to support me trying to find a developer, and ended up doing so much planning that the city actually asked me to be the developer. So once the area got blighted, you know, by the alderman, who was Terry Kennedy at the time, he's someone else who knew me since I was 19. He supported, you know, me taking a stab at it, and nothing was given. You know, we've had our challenges, and each time we've come out on top with better planning, better projects, and a better vision for what this community could be.
Now you've been working at this almost probably almost a decade now? You've been banging at
It
this?
feels like it, but we're only about 6 years deep and only about 2.5 years of actually having development rights.
Now, I remember about 6 years ago, you called me about a section over there that you were trying to find out what was happening with, and I passed on as much information as I knew about it.
Yep.
And now you have it took a minute, but you are moving into a situation where you guys are ready to break ground?
Yeah, the first couple of years was really just community engagement, you know, trying to get our neighbors prepared, you know, hey, there's some development that we're trying to make happen here. And of course, that always triggers fear. You know, is gentrification happening? You know, am I going to be pushed out? What happens to my property taxes?
Exactly.
So the first couple of years was just, I created a housing board, tried to get everybody involved, get them excited. And then the next year just kind of became working with some of the problems of the community, the vacancies, the crime. You know, we had a couple blocks that was piping hot. So, you know, trying to move that crime off those blocks to prepare the community for development was really the first couple of years. And then that third year was trying to get banks and investors and lenders interested in loaning money in this area, which essentially is just red line, period, you know. But we finally gained enough traction, to we've raised millions of dollars. And so now
what is that zip code over there?
63108 and 63113.
Okay, but and with 108, you were still getting some kind of discriminatory action?
Yeah, because 108 crosses the street and it crosses over to the Fountain Park side. So the first couple blocks is still 63108.
Yeah.
So even though, as you know, parts of 108 are fantastic, this particular community was not.
No, it's not. It really is not. This is Fountain Park you're talking about.
Yes.
Those are some beautiful homes over there.
Oh yeah.
Absolutely beautiful brick homes. We're talking about 100-year-old century homes.
Century-year-old, some of them are 3 stories. This was where the black muckety muck used to live. This was where folks live, you know. And you know, a couple generations go by the time the house is handed down to the grandbabies, you know, the wealth isn't there. maybe you've created a boarding house situation, and now,
Sure.
you got problems. So what we're trying to do is create opportunities for those grandbabies to stay in those homes, you know what I mean? And some of the elders that are still there to keep their homes and keep up with taxes, and while at the same time inject the wealthy market rate homes that we need to stabilize the property.
So you're not a developer that's coming in and blighting out everybody and moving the disadvantaged out and trying to just, because we've seen that happen in
Yeah,
some of our communities.
and sometimes we think that's the only way. The only way to bring a community back is to push poor folks out, but that's actually a myth. The greatest strength of this neighborhood actually was the vacancies, because the vacancies allowed me to do infill instead of displacement. So we don't need to push out anyone to put new homes in. There was enough vacancies to just do infill. So we can keep people in their homes and still bring in market rate homes, and nothing is disrupted except, the property taxes go up as a result of the assessment of the area. And we're even
Okay.
working on ways for homeowners to get grants so that their taxes can stabilize. And one of the things that we included in the request for development rights is tax abatement. So if you're doing improvements on your home, I can actually abate the taxes and keep you at where you are for at least 6-7 years.
Wow, this is a wonderful project that is really going to make a difference for folks in a community that for a long time, after the heyday part that you were talking about earlier, then all of a sudden we started seeing this slow slide to the, and I think I actually saw it when integration became a movement here in St. Louis. Because that whole area over there was all high cotton for a long time, and you had businesses that were there. They were Black-owned businesses, doctors, attorneys, all kinds of businesses up and down there. And then when those businesses left, when those malls opened up, when folks decided, oh, I want to move to the county and yada, 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 they abandoned beautiful homes like that.
Beautiful homes.
I
These
mean,
beautiful brick structures.
Right.
There's white flight, and then there's also black flight.
Oh, big time black flight.
So,
Big
so,
time black flight.
you know,
They can talk about, right. I mean, what the beautiful thing that I have seen within I'd say last decade or so are colleagues of mine, associates that I've met down the line who were raised in Berkeley, raised out in North County area, Ferguson or whatever, but they decided to come on down there and buy a house on Cabiny or, Cates or the Maple area for taxes. And they laid those houses out, Kevin.
Oh yeah. Some people get it. I mean, the brick, St. Louis brick is sought after all over the country. So the architectural value of some of these homes over here is through the roof. You
Yes.
can take a home in Fountain Park that might appraise at, let's just say 100,000. If you picked that home up and moved it 100 feet across the street in the Central West End, you would not be able to get that house less than 3. It's the same house, so the community portion of it is where we have to get involved and start saying, no, we're going to take control of our own property values,
Right.
and we're going to stabilize this neighborhood. And often it's two conversations. It's either the conversation with someone who understands the value of the real estate or the person who understands the value of the community. But they're really hand in hand. They're one and the same.
They really are one and the same. Now, that other part that's involved in it is the politics. I saw you on a recent HUD committee meeting where your project was approved and it's gone to the full board of aldermen to be approved, da, 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 da. How has it been for you dealing with politicians and making sure this thing moves forward? Because that can be a contention with some folks.
100%. I tell everyone who is now interested in development, because there's a lot of people now figuring it out. If Kevin can do this, we can do this, and because that was not my background. But
Right.
the key is the alderman. So we got really lucky with Jesse Todd. Jesse Todd was a lifetime member of this neighborhood. He was the committeeman for the past 30 years. He got it. And so he was like, whatever you need, I'm supporting it. As long as it's, consistent with the values of what we want for this community, And that was the key to moving everything forward. If you don't have a relationship with the alderman, you're dead in the water. So we got really lucky with Jesse Todd. Well, the community got lucky, and I was happy to do the work.
Right, and it's so wonderful that you were there. You had prepped for this, and you'd been working on this for some time, and now you're seeing this whole thing come to fruition, and you're moving forward with it with grace. So when are we going to see things really get explosive here with your project? Are we talking, what, 2-3 years down?
No, into this year. We're finally through the planning process. So yeah, we should be breaking ground on Elevation, which is a 30,000 square foot office building, mixed offices, retail at the bottom. Our TIF was approved, so those are street infrastructure improvements. We break ground on that in December. At the same time, we're breaking ground on a 200-unit market rate apartment building directly across the street at Delmar and Euclid. So shovels in the ground in July, big shovels in the ground in December. So once 2022 turns around, we've got 3 more projects in the pipeline that we're putting in queue. So all of this is, and that's just the commercial side. On the residential side, we have 6 homes under construction now. We're going to add another 4 this fall. And as long as the market is there, we can keep adding homes, a minimum of 10 a year.
Wow. So it's moving and it's fired up. You're talking technically how much the homes might cost an individual?
So the homes are coming in to rehab at about $225 and ground up at $250. So what we're hoping for is to work with the city to create a little subsidy to knock at least $50,000 off each of those homes. Our goal is to get it under or at the affordable housing ceiling, which is 180. But it's just a matter of cost. We're trying to do economies of scale with a couple other communities, but even lumber is up 30% since COVID.
I was going to say that, yeah.
But the upside of it for us is the residential homes that we're building are not profit drivers, because we started this project just for the community. We didn't start it to get rich. So even if there's no profit in the homes for us, quote unquote profit, we just can't take a loss, and we can move those homes onto single family homeowners.
And you're going to do a really good job at it. Kevin, call me anytime if you need some help on getting the word out on something. I really do appreciate you coming on the program and talking with us about this. I'm so proud of you. You're going to make me cry. All of y'all going to make me cry. It's just wonderful to see you doing some things. Check out what Kevin Bryan is doing over there. Look up what's going on with Kingsway. We've got the information for you here on the show so that you can really look at what's happening there. And he may need some help. Give him a call to see what you can do for him. So make a difference here in the St. Louis area. I want to thank you for tuning in to City Corner. Thank you for being around, and we will see you the next time. Have a good week. And don't forget, you are wonderful.